I will start by saying I'm a midwife, so the timing was kind of good. The State of the World's Midwifery report was released last year, and it declared that 87% of reproductive health care could be handled by midwives. Currently in the province of Ontario, midwives do provide a full range of reproductive health care, but only if you're pregnant or within 6 weeks postpartum. The important tenets about reproductive health care from the State of the World's Midwifery report was that reproductive health care has to not only be available, but has to be accessible, it has to be acceptable, and it has to be also of a high quality. I'm presenting my quantitative findings from my survey. I also conducted qualitative interviews. For my survey, I adapted something called the Hierarchical Model of Health Service Quality. This tool was designed, it's quite a reliable tool, designed in Australia, but only trialed in an urban setting using general practice and oncology clinics. So I was using this tool in Canada, in Northern Ontario, and examining reproductive health care. Had 191 surveys were completed. This represents a confidence interval of 0.07. The participants in my survey matched the population of Northern Ontario, with the exceptions of they were more highly educated, which speaks to my recruiting techniques probably, and also Francophone women were more represented, but I did make the efforts to translate my survey into French, so that is probably the result. So the results of my survey, I found that 46% of women stated that having a female caregiver for their reproductive health care was important to them. A further 20% said that this might be important to them. 87% of the women who answered my survey were compliant with current PAP screening recommendations. Again, this is higher than the results reported for Northern Ontario or Ontario. The most likely reason they were complying with recommended screening was that they liked their caregiver. The number one reason stated for not complying with recommended screening was that they were too embarrassed or modest. And how my tool informed this, the hierarchical model says your perceived quality informs your opinion around satisfaction with your care, and that informs behavioral intentions. So if women reported the higher quality of their care, they were more likely to PAP screen, and my results did suggest that that was true. Women rated the technical quality of their care highest, with interpersonal, administrative, and environmental ratings being lower. 47% of women currently receive their reproductive health care from physicians, but only 38% of women reported this as being their choice of where they wanted to go for their reproductive health care. The second most common choice, and it's not choosing midwifery care as a second choice, but the second most highest number of women, or roughly a third, prefer to see midwives for their reproductive health care. And this was only followed slightly behind by nurse practitioners. So overall, I conclude that women are generally satisfied with their reproductive health care, but they're looking for other options, and they're looking for options outside of physicians. So here is an opportunity to bring allied healthcare providers, particularly midwives, into providing a fuller range of reproductive health care to women.